So our presentation is on the ethical dilemma of a great boss. So starting off, I'll read out the ethical dilemma. So Lisa Lawrence thoroughly enjoyed practicing as a dental hygienist. It was important to her to work in a practice that provided quality patient care. She also enjoyed being part of a good team and enjoyed the camaraderie of the dental office. Employees sometimes ate lunch in the office and on other occasions went out to lunch as a group. Dr. Frank Harris, Lisa's boss, usually went out to lunch by himself or to meet another dentist. Frequently after lunch, Lisa noticed that Dr. Harris smelled like alcohol. She picked up the same smell in the morning, but also noticed that he used a mouth rinse before examining a patient. She wanted to believe that the mouth rinse is what she smelled, but it was suspicious that it was the smell of alcohol. Lisa mentioned to her fellow employees. They acknowledged Dr. Harris has a history of alcoholism, seemed to be managing it through Alcoholics Anonymous, but recently had started drinking again. His dental assistant, Corey, assured Lisa that when he appeared unsteady or tentative, she helped out to assure patient care went smoothly. Lisa suggested that to the office manager that she wanted to help Dr. Harris by reporting him to the State Dental Society, which had a program to assist dentists with a substance abuse problem. The office manager, Debbie, became very protective of Dr. Harris. She indicated that all staff was receiving generous salaries, and if Dr. Harris had to stop practicing to participate in the recovery program, the staff could lose their jobs and incomes. She reminded Lisa that this had been an ongoing problem and that all the staff had worked together to help Dr. Harris when he was in a compromised state. Debbie reminded Lisa that they were a team and they needed to work together. So first off, we're going to start talking about the 6-step decision-making model. So the first step of that is to identify the ethical problem or dilemma. Second step is to collect the information. Third step is to state all the options. Fourth step is to apply the ethical principles to the options. The fifth step is to make the decision, and the sixth step is to implement that decision. So in our ethical dilemma, it falls into the category of an impaired professional. As from our book, the impaired professional is situations in which the dental team member cannot or should not perform dentistry due to the dependence on alcohol, drugs, or other substances. Identify the ethical dilemma or problem. Lisa suspects that her employer, Dr. Harris, has been practicing dentistry under the influence of alcohol. She is unsure if she should report the alcohol use to the state dental society, potentially risking her job of her coworkers, or if she should remain silent, like her office manager said, to protect her job, her coworkers, and the reputation of the dentist, Dr. Harris. So while we were collecting the information, Dr. Harris has an history of alcohol abuse. The staff had noticed signs that Dr. Harris has been using alcohol again. This includes unsteadiness, frequent mouth rinse use, and the smell of alcohol. The office manager had discouraged Lisa from reporting Dr. Harris due to financial and personal concerns. The staff had all worked to cover him, and the State Dental Society does have a substance abuse program available for dentists.
After collecting the information, these were the options that were brainstormed. Do nothing and continue to work with the team to cover for Dr. Harris. Schedule a private meeting with Dr. Harris to confront him about her concerns. Report Dr. Harris to the State Substance Abuse Program, or report Dr. Harris to the State Board of Dentistry. Now applying the 4 ethical principles to our ethical dilemma. Autonomy. Self-determination and the ability to be self-governing and self-directing. Patients have the right to safe and effective patient care. If an impaired dentist is treating them, their autonomy is compromised. Beneficence means to do good. Lisa has a duty to act in the best interest of her patients. Non-maleficence. Do no harm. Allowing Dr. Harris to practice dentistry under the influence of alcohol is putting her patients in harm's way. Justice. Fair and appropriate treatment of individuals. All patients have the right to equal and safe care, regardless of financial concerns for the office. Now to take those 4 options and apply the ethical principles to each one. Our first option we had was do nothing and continue to work with the team to cover for Dr. Harris. This option directly conflicts with all 4 of the ethical principles. Option 2, schedule a private meeting with Dr. Harris to confront him about her concerns. This option upholds beneficence and autonomy. Option 3, report Dr. Harris to the state substance abuse program. This option would uphold all 4 ethical principles. Option 4, report Dr. Harris to the State Board of Dentistry. This option upholds non-maleficence and justice. This lays out the pros and cons for each one of our options. Option 1, the pro, the office would not have any disruptions and employees would retain their jobs. A con would be violates the ADHA Code of Ethics due to enabling an unsafe and deceptive practice. Option 2, the pro is reasonable first step and demonstrates compassion towards employer. A con is that Dr. Harris may not do anything after the confrontation and violates the ADHA Code of Ethics. For option 3, the pro would be it protects and prevents harm to patients. A con would be practice and employees may take a financial hit. For option 4, a pro would be a definitive way to prevent patient harm. A con is there are serious consequences for Dr. Harris. This is just another way of laying out what of the 4 principles are upheld, and we kind of went over that a little earlier in a different slide, but for our first option, none of them are upheld. Our second option, beneficence and autonomy, are upheld. In our third option, all 4 are upheld. In our fourth option, non-maleficence and justice are upheld. Making our decision. After carefully examining each option and their pros and cons, the option that is the best for the scenario is option 3. Option 3 is report Dr. Harris to the state substance abuse program. Why this option is the best is because it upholds all 4 of the ethical principles, and it's also the best choice because it protects the patients and supports Dr. Harris in his recovery.
Step 6 is implementation of the decision. First, Lisa should document her observations, recording specific instances when Dr. Harris smelled like alcohol, appeared unsteady, or used mouth rinse to mask odors. She should keep her notes factual and detailed to avoid it looking like gossip or speculation. Second, she should consult policies and procedures, which would be reviewing state dental board guidelines and the office's policies on impairment and reporting. Then, identifying the proper authorities, which would be the state substance abuse program. Then, she should report to the appropriate authority immediately, submitting a confidential report to the state substance abuse program and providing documented observations without any exaggeration or judgment. The ethical principles upheld by this implementation of the decision would first be autonomy. Dr. Harris has the opportunity to choose his recovery. Beneficence. Action is taken in the best interest of Dr. Harris and his patients. Non-maleficence prevents potential harm to patients at Dr. Harris's practice, and justice, ensuring fair, safe, and competent care for all patients. After implementation of the decision, there are many possible ways that people could respond. First, Dr. Harris could accept the intervention and agree to work with the state substance abuse program. He could enter a recovery program while protecting his license and ensuring safe patient care. Next, Dr. Harris could also become very defensive or angry, possibly denying the issue and resenting staff or Lisa for their involvement in this plan. The office manager or other staff could also resist this plan, fearing the loss of income and instability in the practice. Next, the state substance abuse program could step in with resources and structured support for Dr. Harris's recovery. After implementation of the decision, there could also be consequences. This first situation isn't so much a consequence, but rather a benefit. If Dr. Harris accepts the help, patient safety is protected. Dr. Harris will get professional treatment and the practice could maintain its integrity. In the long term, his practice and patients will both benefit from this option. Second, if Dr. Harris resists or denies the problem, his license could be suspended, and this could lead to disruption for both the staff and the patients. Next, if the office manager and staff resist reporting, tension and division may arise within the practice. Lisa may face may face backlash for acting ethically. However, failure to act would leave patients at risk and could implicate staff due to negligence. Next, inaction could result in harm to the patients, lawsuits, and loss of professional credibility for everyone involved. Dr. Harris's impairment could eventually lead to patient injury. After implementation of the decision, what we hope will happen is that Dr. Harris receives the support he needs through the state program and returns to the practice safely. We hope that the staff understands the importance of protecting patients and recognizing that long-term stability depends on ethical and safe care, not just covering up the problem. We hope that the office culture shifts towards accountability and professionalism while valuing both teamwork and ethical responsibility. Lastly, we ultimately hope that patients remain safe, that Dr. Harris recovers, and that the practice can continue successfully after trust is restored.